The following segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I'm your host, Shay Paul, and today I have Dr. Jared Chapman of Living Well joining us. Dr. Chapman, it's great to see you.
Oh, it's great to see you, Shay.
So, today we're going to talk about one of your most popular products there, and that is Botox. And we're going to talk about some of the uses that people may not think of
Yeah,
other than your upper face.
correct. So the FDA has approved the use of Botox in the upper face in all three areas: the glabella, the upper forehead, and the lateral canthal lines or the crow's feet. So the 11s, the crow's
Mhm.
feet, the horizontal lines on the forehead. That's the cosmetic uses of Botox that have currently been approved. But we do use Botox off label in other areas of the face to really help improve the aging process and also to help, just to change things sometimes that maybe are over exaggerated from our expressions. So, one of the things I like to talk about is the down turning of the mouth, the corners of the mouth that turns down. You have a muscle on either side of your mouth here called the depressor anguli oris, and it's at an angle and it attached to this area of your mouth, thus oris. And what happens is when that muscle contracts, it pulls the corners of the mouth down, making us look sad. So as we begin to age and overuse this muscle, we get downturned corners of the mouth. Putting a
Okay.
little bit of Botox right into the depressor anguli oris will allow for a nice lift on the corners of the mouth, just slightly, so that the mouth looks maybe more at a rested neutral and the patient doesn't look sad all the time. Second thing is we start to see bubbling of the chin from overuse of this muscle right in the front of the chin called the mentalis. We can actually inject the mentalis. The mentalis elevates the chin and causes it to wrinkle and crinkle. When
Mhm.
we relax that muscle slightly, we lower that elevation a little bit, we relax the chin, and we don't get that bubbling or what we call Puda orange, what looks like orange peel skin over
Right.
that area. And you see that a lot, and it is preventable and treatable. My favorite thing that I love about Botox off label, and I have just done it to myself, and I absolutely am amazed at how well it worked, is the jawline. So we have this big muscle on the side of our face that comes all the way down to our collarbone and all in the front here, and it's called the platysma. Nice, neat name. But that platysma comes up and wraps into our face. And what it does is it depresses that area along the jawline. It causes the jawline to pull down in
Uh-huh.
expression.
Uh-huh.
We can actually go in there and Botox its insertion here on the jawline. And when we do that, it relaxes the face enough that we can pretty much tighten and eliminate that jowling that we have if it's mild.
Wow.
So we
Wow.
can really sharpen the jawline. So I had mine done last week by Ben, my nurse practitioner, and I kind of forgot that we did it. And a couple of days later, I'm looking in the mirror and I'm like, gosh, your
Man,
jawline
I
looks
look good.
amazing. And I was like, that looks really good. And I thought, but I haven't lost any weight. And I kept thinking, I haven't done anything different.
Right.
So then the next day, it was Father's Day, I took a picture with my daughter and I noticed my jawline again. And I was like, oh, I had my
That's right.
injection and I had never done that before. And it was such a dramatic difference in the lift of the jawline and the smoothness and the tightness. So I was quite impressed with that treatment. So again, that's another treatment that can be done. One last treatment I'm going to talk about that patients who suffer from this could really benefit from, and that's excessive sweating under the
Mhm.
arms. Coming off the face, going under the arms now. Patients, they can really drench their shirts
Sure.
early on, right after they get out
Especially
of
in
the
this weather,
shower.
right?
Yes. Oh my gosh, yes. And so it's excessive sweating. I'm not talking about someone who just sweats a little bit through their deodorant. I'm
Right.
talking about this is definitely pathological and it's very uncomfortable for the patient. It's very embarrassing for the patient. We
Sure.
can actually inject Botox under the arm superficially, and it shuts down the little tiny muscle that's a component of the sweat gland, and it stops the sweating for 8 months. And so those patients
Wow.
get a significant reduction in sweating, a reduction in their dry cleaning bills, a reduction in just feeling uncomfortable in public. So I highly, uh, uh, you know, want to say to patients who suffer from this and it's debilitating to them, they don't want to take their jacket off and they don't want to wear silk blouses and things like that, come in and see us, get a consult regarding this, because we can make a difference in this. And it is quite amazing. And again, unlike other areas of Botox that you have to do every 3 to 4 months, the arms, the sweating stops for about 8 months with the
That's
treatment. So
great.
it
That's
is. It's
great.
quite amazing.
I'm
So
assuming because you're not, that area is not moving a
it's
lot.
just, I
And,
think the muscle is small, and I think
oh, I
the
see.
amount is just enough to overpower it, and it just
Okay.
works really well. But it's about an every 8 month treatment. Patients who
That's
do this in our
wonderful.
practice, they know exactly when to be here, and it's usually right on the 8 month mark. So
Wow.
it's quite amazing. So Botox, again, one of the most studied toxins on the market, one of the most amazing medications that we have. I've just mentioned a few things it does. There are so many medicinal things, medical things that it can do
Sure.
from esophageal spasm
Sure.
to bladder spasms. I mean, there's just so many things,
Yeah.
muscle spasms that we're using it for now. It is quite an amazing molecule.
And it's been around a long time and
It
studied
has.
well. So, yeah.
Yes.
Okay. Well, Dr. Chapman, thank you so much for being with us and for the education. I feel like I had an anatomy lesson, just all kinds of good stuff today. So, thank you so much.
Thank you for having me, Shay.